I'm Professor Monica Monaghan. I am the Associate Sub-Dean for Queen's University students and the site lead for the medical students from the Royal College of Surgeons of Ireland. And I'm delighted to introduce Mr. Michael Mullan and Miss Rachael Coulson, who are operating in our theatres in the South West Acute Hospital this week. And what is particularly exciting is that for the first time across Europe, we are using technology called rods and cones to teach our medical students the virtual experience of being in theatre.
Yesterday we had quite a good day in theatre. We had 2 theatres running and we did a combination of large cases and more intermediate type cases. So yesterday the students saw a large hiatal hernia fixed, which would be an unusual operation. There's only about half a dozen surgeons here in Northern Ireland that actually do that operation. And then they saw a series of 5 gallbladders and then a small abscess dealt with as well. Now, the benefit of this technology is we can't have all the students in theatres with us. It only tends to be 1 or 2 at a time due to infection control and just the number of bodies in the theatre. But the beauty of this technology is that all the students actually can watch the surgery live, that we're able to communicate with them directly and speak to them about the operations as we proceed. So we're actively teaching them as the case is progressing. And the benefit of that is not just for the students, but I also see it as being a huge benefit for surgeons as regards proctoring or the introducing of new operations. And it is just fabulous to have this technology down in Enniskillen to get an opportunity to use it. And I think without doubt that we will be using it again in the future, not just here in Enniskillen, but in other hospitals across Northern Ireland. Because I don't think that we've fully engaged yet with these new technologies. Theatres tends to be a very isolating environment for surgeons in that, you know, you have a consultant there, they're there on their own. But with these smart glasses, we can dial into colleagues, we can bring colleagues in to our operation. They can see our first-hand view from anywhere, not just in Northern Ireland, but from across the world. And speak to experts and actually get them to come into our operations and give us an opinion. And I think that this will have not only, you know, a benefit for people here in Fermanagh, but right across the north.
I'm Rachael. I'm a ST5 general surgical trainee. From a surgical training point of view, I think this is a really exciting week, an exciting opportunity. I'm very grateful to be involved and able to come across and assist Mr. Mullan in theatre. From our side of things, certainly these glasses will allow in the future, certainly our general surgical trainees that maybe wouldn't have as many numbers or aren't able to get to certain specific types of cases, an opportunity to actually be not virtually in the room essentially and be able to see cases that they wouldn't ordinarily see. I think it's really exciting that what the South West Acute are doing here alongside the rods and cones, and hopefully we can get that across to other sites as time passes on.